How do different thermometers measure toddler fever? Imagine trying to figure out if your toddler has a fever without causing a fuss. Knowing how different thermometers work can make this easier and less stressful. When your child feels warm or looks unwell, you want to get an accurate reading fast. That's where understanding the types of thermometers comes in handy. Rectal thermometers are often considered the most precise for toddlers. They work by gently inserting the thermometer about 1/2 to 1 inch into the child's rectum. This method measures the core body temperature directly, making it the most reliable way to detect a fever in children under 2 years old. Because toddlers can't always hold an oral thermometer properly, rectal readings give a true picture of their internal heat. Digital thermometers can be used in the mouth or under the arm. Oral thermometers are placed under the tongue, but they are not usually recommended for children under 5 because they might not keep the thermometer in place. Armpit or axillary thermometers are easier to use. You place the thermometer in the child's armpit and hold their arm snugly against their body. This method is gentle and quick but can sometimes underestimate the actual temperature. If the armpit reading seems normal but your child looks warm or uncomfortable, it's best to check with a rectal thermometer. Ear thermometers, also called tympanic thermometers, measure inside the ear canal using infrared sensors. They are fast and convenient, giving a reading in seconds. However, they can be less reliable in toddlers because their ear canals are small or curved. Proper technique, like pulling the ear gently back to straighten the canal, helps improve accuracy. If the ear temperature seems normal but your child shows signs of fever, it's wise to verify with a rectal thermometer. Temporal artery thermometers scan the forehead surface using infrared technology. They measure the temperature of the temporal artery just beneath the skin. These thermometers are non-invasive, quick, and comfortable for toddlers. They work well even if your child is sleeping or resisting other methods. Recent studies show they can be quite accurate, making them a good choice for busy parents. Less accurate options include plastic strip thermometers that change color on the forehead. These are simple but tend to give unreliable results. Digital pacifier thermometers are also not recommended because they often do not provide precise readings. For parents, the best approach is to use a rectal thermometer for children under 2 to get the most accurate reading. For quick checks, armpit or temporal thermometers are helpful but should be confirmed with a rectal measurement if your child seems unwell. Always follow the manufacturer's instructions, especially for ear thermometers, to ensure accuracy. Clean the thermometers thoroughly after each use to prevent infections. Remember, a fever is a sign your toddler's body is fighting something, not an illness itself. Keep an eye on their overall behavior and comfort level alongside temperature readings. Knowing how each thermometer works helps you make better choices and respond quickly when your toddler needs medical attention.